Hello everyone, today's video is about MSM, also known as methyl sulfonylmethane, also known as high-dose sulfur therapy. There were a few questions that were submitted on other videos, so we're going to do a bit of a Q&A, and then I'm also making an announcement about an upcoming podcast that is all about MSM with the one and only Dr. Kathleen Janel, who's, I believe, the leading expert in high-dose sulfur therapy / high-dose MSM on the planet at this point in time. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So I'll just quickly talk about the upcoming podcast episode, and then I'll get into the Q&A here. So Dr. Janel and I are going to have another interview. So she was on my Overcoming Chronic Illness podcast, I think in late 2024. There's been a lot of interest around that episode and subsequent YouTube videos and on other social media platforms. Most of the folks watch me on YouTube, but some on other platforms too. And so lots and lots of questions about MSM and also just a lot of comments in the comment section about like how MSM has been so helpful for people. Mostly information about it helping with chronic gastrointestinal issues, but also chronic inflammatory and like joint and muscle aches and pains and things like that. But then some other tidbits about things like just helping people to feel better overall, better energy, that kind of thing. So it could be a really, really helpful therapy. So thank you for all the comments, and it's just I love reading those comments, and then I see all the benefits in my practice too. I have some local colleagues who have been using high-dose MSM with their patients and just seen so much benefit from it. So it's a really wonderful therapy. So Dr. Janel and I are going to be doing a kind of like a Q&A, like kind of ask me anything podcast episode. The first episode we had was all about the nuts and bolts of like what the heck is high-dose sulfur therapy, what's it all about, the rationale. And so this is just going to be kind of just like a rapid fire Q&A. So if you have questions for Dr. Janel that you would like me to ask her, please submit those. Just post in the comment section and I will compile those. Today is December, what day is it today? It's December 3rd. Our interview is scheduled for December 23rd, so right before the holiday season. I'll probably be posting that over the holiday season, but yeah, just submit your questions and I will compile them, and I will ask them all of Dr. Janel. So we have, I think, probably 45 minutes or so to chat, so just, yeah, we'll get through a bunch of them. In terms of the questions that were submitted to me to answer today. So there were a couple of questions that were around taking MSM with blood thinners. MSM / high-dose sulfur therapy is bringing more sulfur into the body, so anything that is sulfated in the body can be enhanced by taking MSM, theoretically. So one of the sulfated compounds that are in the body, or that are present in our bodies, is heparin sulfate. Heparin is, of course, a drug, but it's also the stuff that occurs naturally in the body as well. It has a blood thinning effect. So we want to make sure we have enough heparin sulfate in the body to keep our blood thin enough, because we certainly don't want blood that's too thick. That equals, heart attack, strokes, impaired circulation, different vascular issues, that kind of thing. But then we also don't want to have excessive blood thinning, because then we, bleed out, and that's not good either. So the question here is, let's see here. Have you worked with MSM with any clients that have been on blood thinners, and if you've seen any interactions? There's another question about someone who is taking aspirin. I'm wondering if it's okay to take MSM with that. So to date, I have not seen any issues with folks on blood thinners who are taking MSM at high dosages. So I've not seen, and I've also not seen any issues with folks taking high-dose MSM who aren't taking blood thinners and having an obvious blood thinning effect. There are certain supplements that I use, like fish oil, vitamin E, and proteolytic enzymes like nattokinase and stratiopeptidase that we will sometimes intentionally use to try to induce a blood thinning effect in the body. So we'll use it at higher dosages if people have kind of a hypercoagulable tendency. But then there are some patients who are just really sensitive to those things, and they will get a spontaneous blood thinning effect that we're not intending. So I've had patients come in saying, I've been taking fish oil, and like when I get a cut, I cut myself in the kitchen or something when I'm chopping vegetables, and like my blood it's taking quite a while for the wound to heal. I like for the bleeding to stop. Or folks who are like, I've been taking these proteolytic enzymes, and like now my gums are bleeding when I floss, and I've been flossing for years, and my gums never bled, and I started this stuff, and as the dose has been going up, my gums are bleeding. So I've definitely seen a very definite blood thinning effect from certain supplements, like the ones that I just listed. I've never ever seen that from MSM. And I've had lots and lots of patients who are taking very high dose MSM, like, 30 grams a day, so kind of mega dose MSM. I've had some patients, myself included, who have gone on even higher dosages as therapeutic trials, because there are some kind of old-timey recommendations. There's this book called I think The Miracle of MSM or something like that was written about 25 years ago. The docs in there were talking about some of their cases where patients with like more severe syndromes and autoimmune conditions, like they would sometimes dose them up as high as like 45 or I think even 60 grams of MSM per day. So I've had a few patients who have gone to higher dosages, and I've never, ever seen a blood thinning effect. And then also patients who are on blood thinners, I haven't seen an additive effect with that either. So I think that MSM has the potential to help reduce blood viscosity if someone was sulfur deficient and couldn't make enough heparan sulfate, because I've had patients who report different vascular benefits. Some patients report that like their hands and feet are warmer in the winter months, like in the colder months of the year. And I've had a few patients who have come in saying that their erectile function is better. So wasn't prescribing it with those intended purposes, but those are some, the patients were happy with those side benefits. So there does seem to be a blood flow enhancing property, but I think it's one of those things where if the body's deficient in sulfur, then, oh, now I can make enough heparan sulfate to have healthier blood flow, like optimal blood viscosity, not too thick, not too thin, kind of that just right Goldilocks amount, but it doesn't seem to have an excessive blood thinning effect. We see that with a lot of different natural products. For example, when folks take medicinal mushrooms, like not psychedelic mushrooms, I have to kind of clarify that now because lots of people out there are microdosing and doing psychedelic assisted therapy and stuff like that, or just recreational psychedelics. But folks who are taking things like reishi mushroom, Coriolis mushroom, also known as turkey tail, agaricus mushroom, whether they're using those things for anti-cancer cell benefits, immune system boosting benefits, brain health enhancing benefits, whatever it is, when patients have low red and white blood cell counts, I've seen that, like, especially when they're going through chemotherapy and things like that, I've seen those medicinal mushrooms enhance those counts many times. But patients who have normal counts, I've never ever seen those mushrooms boost up their levels. It's like, oh, the white blood cell count's just going up and up, the red blood cell count's just going up and up and up outside of a normal range. Never ever seen that happen. So there's something about the wisdom of the body working with these natural compounds. It just has kind of a regulating effect. So I'll leave that one there. I think I answered that pretty thoroughly. There was another question. The same person posted two questions. It said, another one I'm curious about, and I know what the answer should be, but have you ever worked with any athlete clients who are prone to injury, and by using MSM they have reduced their likelihood of injury? So I only have one person that, actually, sorry, that's not true. I have two. So I was going to say the only person that is intentionally using MSM to help prevent injury that I know of is me. I've mentioned in other videos that I take high dose MSM primarily because it helps to prevent me getting injuries when I'm doing my martial arts classes, like jiu-jitsu and MMA classes. So, go pretty hard in those classes. My body gets contorted into, like, the one description of jiu-jitsu that I love is that they call it the art of folding someone's clothes while they're still wearing them. So we can get pretty pretzel-y, and I'm a middle-aged individual, so it's a bit hard on the joints. But yeah, the MSM has really reduced my propensity for injury. And then also when I do get injured, because it still happens from time to time, just sprained my toe last night doing jiu-jitsu, which is lovely. My rate of injury recovery has really gone up. I was getting prolozone injections, PRP injections, things like that for different injuries that were just taking a while to heal, because of course I'm stubborn and I'm addicted to these martial arts. So get an injury, and as soon as it's healed enough to like go back and start training, I'll go do it, even if I'm still partially injured. So a lot of re-exacerbations of tendinitis, sprains and tendinitis and different things like that. Anyone who trains jiu-jitsu knows what I'm talking about. You get back on the mats before you're fully healed, because it's just, we're so addicted to the sport. But anyways, long and short of it is my need for injections has gone way down since I started taking high dose MSM. So yeah, it's been very helpful for me. I do have one other patient, and with this patient, they it's not specifically to reduce athletic injury, but they just have a job that's very physically demanding. They have a history of lots and lots of sports injuries from days gone by, and they have found that the MSM has been super helpful for just preventing those like workplace, like the line of work related injuries. So I do think that it can be an effective tool for that, but I just don't have that. It's just not my patient base is not like, you know, athletic optimization. I do have some patients where we work with that, but it's not the majority of folks I see. So I don't have a ton of clinical experience with that. There was one other MSM question, but I think I'm going to have to pause on that one because I have a patient that I am 2 minutes overdue to go see. So I'm going to stop the video. Talked too much today, but yeah, I will post another MSM video coming up about the difference between the theory between taking kind of the Dr. Janel approach of a lot of us are sulfur deficient, and then there's this other brilliant naturopathic doctor who I also have interviewed for my podcast, Dr. Greg Nye, and he talks about actually trying to reduce sulfur intake, specifically sulfite intake, because that seems to be associated with certain positive health outcomes. So there's a question about contrasting those two seemingly conflicting approaches. That would be actually, I think, a good question to talk to Dr. Janel about at our upcoming podcast, but I'll chime in on that at a future video. If you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And if you have any questions about this topic or anything else, just post in the comment section below, and I will do my best to answer as soon as I can.